Okay, so today I wanted to talk about the treatment for Lyme disease. The Infectious Disease Society of America, IDSA, says that essentially what you need is 2 pills every day for 3 weeks, and that should cure it. However, I'm going to show you my personal protocol for dealing with Lyme. As you can see, it's a little more substantial than 2 pills a day. First, what I have is my Flovent inhaler. I use this. I do 2 puffs a day just to keep my airways clear. And then I have my emergency inhaler, my Pro Air, if I ever have a spell where I can't breathe. And then I'm on, I think it's 34 individual pills a day, and right now I'm going to walk you through just filling up my dispenser for a week. So you can see I have each one of these columns is a day. Most of what I'm on is just like supplements, and half of these are even just to absorb other supplements that I'm taking. For example, with the Lyme, it's to help me absorb the vitamin D that I am also taking, because Lyme eats away at your vitamin D levels. Another thing with a lot of these supplements is you can't take them all at once. You have to break them up throughout the day, or your body just can't absorb everything you're putting into it. This here is a form of lithium. That's to help prevent the degradation of my neural pathways. This is what keeps me sane and, even able to tell you right now what all of these are for. This here is one of the several medications I take to help keep my joints working. I have a lot of days where I'll tell people it feels like sand where my cartilage should be. I'm in my early 20s right now, and there are days where I have to use crutches because my hips are so bad I can't walk. This is B6. This does like 50,000 things that I should be able to remember off the top of my head. Alright, this is one of the antibiotics I take. Lyme disease actually never occurs by itself. There are always co-infections that go along with it, and because of this, it's a very complex condition that can't be treated with just one antibiotic. I'm going to need to refill that one. This is a second antibiotic that I take. So as you can see, I'm actually taking 4 pills a day, and I've been doing this for several months, far more than the 3 weeks as recommended. This here is cat's paw. It's actually best known to help cancer patients fight off cancer. It also works incredibly well for the Lyme bacteria. It's also great for pain management and also joints a little bit as well as boosting the immune system. Here is my vitamin D. Like I said, Lyme depletes a lot of things that are vital in the body, and vitamin D is one of them. This here is naproxen sodium. It's a basic pain reliever. I take one of these every day, not so much to relieve the pain, but to help prevent inflammation. This one is a supplement mixture to help keep my thyroid balanced. Before we figured out what was going on, you could literally see all of my organs through my skin, and I was still eating like a 600-pound man. This also has a lot of the things that Lyme takes away from the body, specifically magnesium is one of the key ingredients in this one, as well as zinc. This is calcium, magnesium, and zinc, because there weren't enough in all the other pills that I had combined, so, you know, just had to throw in a little extra. Doxycycline has everything. Yeah, I have to fill that one too. Alright, this is yet another one to help prevent inflammation as well as keep my joints working correctly. And this one has a lot of turmeric in it. So it actually smells really, really bad. It tastes pretty potent too. This is nystatin. With the number of antibiotics that I'm on, I have to be careful about depleting too much of the good natural bacteria that's in my digestive system. This is to help prevent yeast growth that can happen if you kill off too much of that beneficial bacteria. This is garlic. This is a supplement that's great for a lot of things, including your heart. It's supposed to be good for your memory, your immune system. Speaking of garlic, even in addition to all of these supplements, I have to be very, very careful about my diet as well. There are a lot of things that I have to do, like for example, I put lemon in every glass of water that I drink. I put ginger in just about everything. I'm also using a lot of high acidity foods to help detox my body and get me to flush out all the toxins that will occur when the bacteria dies in my system. Yet another thing to help me with my joints. My joints are one of my worst symptoms personally. Everybody has, you know, different things will be better, different things will be worse. Fish oil, lots of omega-3s. Great for your mind, great for your heart, great for your joints. And one more. This is your generic probiotic. I also have, I take 2 pills a day of a more specialized probiotic that I actually have to keep in the fridge downstairs. That does not go into the pill sorter. So the purpose of these is very similar to the nystatin, except the nystatin is preventing yeast. This is replacing the good bacteria that should be in my digestive system. And even in addition to all of these pills, in addition to all the crazy things I have to do with my diet, once a week I do also have to go in to my doctor's office to get an hour-long IV treatment for vitamin C. And the reason why I can't just take more pills for that is because I need to replace so much in my body that it cannot be absorbed when taken orally. It can't absorb that much through my stomach lining. So there you have it. This is my pill sorter. I don't know if any of you are counting, but I believe that's 34 pills a day right now. I go through this every week. I've been going through this for months, and I will continue going through this for months, and I'll probably lose a couple pills after some period of time, but I will be going through treatment for a couple of years.